why India is still struggling to eradicate tuberculosis even in the year of 2025. Tuberculosis, or TB, remains India's deadliest infectious disease, accounting for 26% of global TB cases so far, according to the latest WHO's data. Despite years of progress, India is now backsliding with over 2 million cases, the highest in the world. Our next report tells you more about the same.
A silent enemy has taken hold of this neighborhood in the northern state of Haryana, tuberculosis. Mahesh Kumar was recently infected with the deadly disease. At the moment, only his lungs are affected, but it could spread to other parts of his body at any time. He is currently on a mix of pills that leave him tired and drowsy.
It feels like I'm living life in a jail. I'm like a prisoner. I spend my days and nights here all by myself.
Mahesh was diagnosed 4 months ago. The government does offer free TB medication and a small food allowance of 10 euros. But Mahesh says he hasn't seen a penny of the allowance.
I'm very upset with our government. They promised us support, but I haven't received any money from them. We're hoping they support us so that I can recover fast. In our city, there are no hospitals and machines for health checkups.
Mahesh's case is not unique. Widespread poverty, poor hygiene, and overcrowding have fueled its spread, affecting over 2 million people nationwide. This private hospital treats dozens of TB patients every day. For the first time in 3 months, Mahesh has been able to make the long journey here for a checkup. His consultant, Dr. Lavleen Mangla, finds the overall situation alarming. He says a shortage of medicine and lack of public awareness are causing the delay in the eradication of TB.
I'm practicing in this area from last 5 years, and the number of cases which I was seeing 5 years back also they're still same, and I don't think there is any decline in the number of cases.
In 2018, the Indian government pledged to eliminate tuberculosis by 2025, a goal it's now very unlikely to achieve. After India's health ministry did not respond to several interview requests, DW turned to a public health expert for insight.
If I may put it in a matter-of-fact manner, the government never was serious about it. But government can do the propaganda. That's what they're doing. Even when we had our GDP rising by at 11%, 12% a year, even in those times, health budget stagnated. Okay, health budget is stagnant even now. So on what basis do we believe that yes, it will be eliminated?
Aid agencies like the Red Cross are stepping in, raising awareness in slums where tuberculosis outbreaks are common.
The biggest challenge that we face is people's hesitation in coming out as TB patients. They do not want to share that they are infected with tuberculosis because they fear the social ostracization. Our job is to dispel that fear. Anyone who coughs for more than 15 days could be suffering from which disease?
Back to Mahesh's home, he hopes he will eventually conquer this chronic illness. But one of the hardest parts is the loneliness that so often comes with the disease.